Myths about being transgender. As a transgender woman, you may have encountered abundant misinformation about being transgender, both online and offline. These myths range from absolutely absurd ideas to ones that can be harmful to the community as a whole. So let us delve into the various myths, stereotypes, and misconceptions surrounding being a trans woman. Cross-dressing. A lot of people inaccurately believe that every trans woman is the same as a cross-dresser, a man dressed as a woman, or a drag queen. This is factually incorrect. There are many who cross-dress or perform as drag queens that do not identify as transgender. And while some transgender women initially experiment with their gender identity through cross-dressing, the difference is that they do identify as women and may undergo HRT or other medical procedures to transition their body and align it with their identity. However, please note that a trans woman need not undergo medical procedures. Remember, all trans women are women. Every trans person is the same. This is another prominent myth regarding the trans community. Please note that the term transgender is an umbrella term. It is usually used to denote a large number of identities, including transgender people, and those who are intersex or gender fluid individuals. Transgender people are those who are born in the wrong body and typically associate or identify with the other gender. They may transition through surgeries, hormonal therapies, and other medical procedures available. However, not every transgender person undergoes these procedures. Being trans is a choice. This is among the more ridiculous myths. Some people believe that transgender people choose to identify with a particular gender. This is far from the truth. Just like cisgender people do not make a choice about their gender, trans people also are born already identifying with a specific gender. Every transgender person is aware that their identity does not fit with the gender they have been assigned at birth and the body they have been born in. Being trans comes with a lot of discrimination, stress, anxiety, and pain if you choose to transition. As a result, nobody would voluntarily choose to put themselves in such an overwhelming position. Most trans people associate with their identity from childhood, long before they understood the concept of making choices. Medical procedures. Another common myth is that trans people undergo just one surgery or none at all. However, every individual is different, and the number of permutations and combinations of surgeries and procedures that different trans people undergo cannot be summarized in this article. However, here are some of the procedures a trans person may choose to undergo: bottom surgery, hormone replacement therapy, breast augmentation, facial feminization surgery, vocal surgery, and more. Obviously, some people choose not to have any surgeries or procedures at all, and that's completely normal as well. Vaginoplasty and orgasms. Transphobia is at the root of this specific myth. There is a widespread misconception that, since trans people undergo bottom surgery and vaginoplasty, their nether regions look fake and cannot result in sexual climax. However, that is completely untrue. Thanks to modern science, the result of vaginoplasty is extremely impressive, and moreover, a substantial amount of sensation is experienced down there, which often retains the ability to reach sexual climax. Sexuality and gender. This is another misconception that is particularly common amongst the trans community, that you have to be straight in order to be a trans woman. Sexuality and identity are two separate concepts, and thus there is no association between those two. It is common for trans women to like men. Similarly, it is also common for trans women to like women. Thus, there are no rigid rules in this area. You can be a lesbian trans woman, and that is completely normal. So, these are some of the myths surrounding transgender people, and we hope we busted them effectively.